Buddha discovered that digestive suffering is one of the first signs of disconnection between body and mind. You don't have digestive problems because you eat wrong. You eat wrong because your mind is at war with your body. These 15 millennial Buddhist methods will teach you to transform every meal into meditation, every digestion into healing. You'll learn why fasting with anger is toxic, why eating with gratitude is medicinal, and how 5 minutes of abdominal breathing before meals can eliminate reflux, gastritis, and bloating you've carried for years. Technique number 3 alone has already cured thousands of monks from chronic ulcers. Subscribe to the channel, leave your like and comment from which part of the world you're watching. Get comfortable and relax. Let's begin. Have you ever considered that trillions of tiny organisms living inside your digestive system might be influencing not just your digestion but your entire health? The fascinating world of the gut microbiome has emerged as one of the most revolutionary areas of health research in recent years, changing how we understand everything from immunity to mental health. Our gut microbiome is essentially a complex ecosystem of microorganisms, primarily bacteria, but also fungi, viruses, and other microscopic life forms that reside primarily in our intestinal tract. What's remarkable is that these microorganisms collectively contain more than 100 times the number of genes in the human genome. This vast genetic contribution has led scientists to consider the microbiome almost as an additional organ with profound influences on our health and well-being. When we talk about a healthy microbiome, we're generally referring to one with significant diversity, many different types of beneficial bacteria living in a balanced state. This diversity appears to be crucial for optimal health. Research over the past 15 years has revealed that our microbiome begins developing from the moment we're born. Babies delivered vaginally receive their first dose of beneficial bacteria as they pass through the birth canal, while those born by cesarean section acquire a different set of initial microbes, typically from the skin and hospital environment. Breastfeeding further helps establish a healthy infant microbiome, delivering both beneficial bacteria and special carbohydrates called oligosaccharides that specifically nourish these good bacteria. As we grow, our microbiome continues to develop and change. By around age 3, a child has established a relatively stable microbiome signature, though it continues to evolve throughout life based on numerous factors including diet, environment, medication use, and lifestyle. Each person's microbiome is unique, like a fingerprint, yet certain patterns of microbial composition are associated with better health outcomes. What's particularly intriguing is how the microbiome influences systems throughout the body, far beyond the digestive tract. One of the most significant roles of our gut bacteria is supporting our immune system. Approximately 70 to 80% of our immune tissue is located in our digestive tract, and the bacteria there help train our immune cells to distinguish between harmful invaders and harmless substances. When the microbiome becomes imbalanced, a condition known as dysbiosis, it can lead to inappropriate immune responses, potentially contributing to allergies, autoimmune conditions, and chronic inflammation. The connection between gut bacteria and mental health represents another frontier in microbiome research. Scientists have identified what they call the gut-brain axis, a bidirectional communication network between our digestive system and our central nervous system. Certain gut bacteria produce neurotransmitters like serotonin, dopamine, and GABA that affect mood and cognition. In fact, approximately 90 to 95% of the body's serotonin, often called the happiness hormone, is produced in the gut with the help of certain bacteria. Studies have found correlations between microbiome composition and conditions including depression, anxiety, autism spectrum disorders, and even neurodegenerative diseases like Parkinson's. Our metabolism and weight regulation are also influenced by our gut residents. Different bacteria have different effects on how we extract energy from food, store fat, and regulate blood sugar. Some research suggests that certain bacterial patterns may contribute to obesity or diabetes, while other compositions may be protective against these conditions. This connection has sparked interest in microbiome-based approaches to managing metabolic disorders. Diet plays perhaps the most crucial role in shaping our microbiome. The foods we eat directly influence which bacteria thrive and which diminish in our digestive system. Fiber-rich plant foods are particularly important as many beneficial bacteria feed on the components of plant fiber that our human cells cannot digest. These indigestible fibers, known as prebiotics, include substances like inulin, fructooligosaccharides, and resistant starch found in foods such as garlic, onions, leeks, asparagus, bananas, oats, and legumes. When beneficial bacteria ferment these prebiotic fibers, they produce short-chain fatty acids like butyrate, acetate, and propionate, which nourish the cells lining our colon, regulate inflammation, and may even protect against colorectal cancer. A diet rich in diverse plant foods, including a variety of fruits, vegetables, whole grains, nuts, seeds, and legumes, tends to promote a diverse and resilient microbiome. Conversely, the typical Western diet high in processed foods, added sugars, and low in fiber has been associated with reduced microbial diversity and increased risk of health problems. Studies comparing the microbiomes of people living traditional lifestyles with those following modern Western diets have found striking differences, with traditional communities typically hosting a more diverse array of microbes. Beyond diet, several other lifestyle factors influence our microbial communities. Chronic stress appears to alter the microbiome composition, potentially contributing to digestive symptoms during stressful periods. Regular physical activity is associated with greater microbial diversity and abundance of beneficial bacteria. Sleep quality and circadian rhythms also interact with our gut microbes, with disruptions potentially contributing to dysbiosis. Medication use represents another significant influence on our microbiome, with antibiotics being perhaps the most impactful. While antibiotics are essential for treating bacterial infections, they don't discriminate between harmful bacteria and beneficial ones. A single course of antibiotics can drastically alter the microbiome, with some studies suggesting that certain bacterial populations may not fully recover for months or even years after treatment. This understanding has led to more judicious use of antibiotics in healthcare. Other medications including proton pump inhibitors, used for acid reflux, metformin for diabetes, and various anti-inflammatory drugs can also affect microbiome composition. Even non-prescription substances like artificial sweeteners have been shown to influence gut bacteria, sometimes in ways that may counteract their intended benefits. Given the microbiome's far-reaching health implications, it's no surprise that researchers and healthcare practitioners are exploring ways to support and optimize it. Probiotics, live beneficial bacteria taken as supplements or in fermented foods, represent one approach. Fermented foods like yogurt, kefir, sauerkraut, kimchi, and kombucha naturally contain live cultures that may contribute beneficially to the gut ecosystem. However, the science of probiotics is still evolving, with evidence suggesting that results depend on the specific strains used, the condition being addressed, and the individual's existing microbiome. More targeted probiotic formulations are being developed for specific health conditions, moving beyond the one-size-fits-all approach of early supplements. For certain conditions like particular types of diarrhea, specific probiotic strains have shown clear benefits. For other conditions, the evidence remains mixed or preliminary. One of the most dramatic microbiome interventions is fecal microbiota transplantation, FMT, which involves transferring stool from a healthy donor to a recipient to restore a healthy bacterial community. FMT has shown remarkable success rates, over 90% in some studies, for treating recurrent Clostridium difficile infections that don't respond to antibiotics. Research is exploring its potential for conditions including inflammatory bowel disease, irritable bowel syndrome, and even metabolic and neurological disorders, though these applications remain experimental. The future of microbiome medicine likely lies in personalization. As testing becomes more sophisticated and affordable, we're moving toward an era where individuals can have their microbiome analyzed and receive tailored recommendations for diet, supplements, or medical interventions based on their unique microbial profile. Some researchers envision designer probiotics or prebiotics formulated to address specific microbial imbalances in individuals. For the average person looking to support their microbiome, current evidence points to several fundamental approaches. Eating a diverse diet rich in different plant fibers provides nutrition for various beneficial bacteria, including fermented foods, regularly may help introduce beneficial microbes. Limiting unnecessary antibiotic use and focusing on lifestyle factors like stress management, adequate sleep, and regular physical activity all contribute to microbiome health. The microbiome represents a fascinating frontier in health science that connects many seemingly disparate aspects of well-being. The bacteria living within us are not merely passengers, but active participants in our physiology, influencing everything from digestion to immunity to brain function. As research continues to unveil the complex relationships between our microbial communities and our health, we're developing a more holistic understanding of human biology, one that recognizes we are not merely individual organisms, but complex ecosystems unto ourselves. This perspective offers new avenues for preventing and addressing health conditions through microbiome-aware approaches that work with, rather than against, the trillions of microorganisms that call our bodies home. While the gut microbiome affects our overall health in numerous ways, its disruption has been particularly linked to one common digestive disorder that affects millions worldwide. Irritable bowel syndrome, or IBS, represents one of the most frequent gastrointestinal conditions seen by doctors today, affecting approximately 10% of the population to 15% of the global population. Despite its prevalence, many people with IBS struggle silently with symptoms for years before seeking help or receiving an accurate diagnosis. Have you ever experienced persistent digestive discomfort that seems to come and go without a clear pattern? IBS is characterized by a constellation of chronic symptoms including abdominal pain, bloating, and altered bowel habits that can significantly impact quality of life. What makes this condition particularly challenging is that these symptoms occur without visible damage or inflammation in the digestive tract. Unlike conditions such as Crohn's disease or ulcerative colitis, this has historically led some healthcare providers to dismiss patients' experiences as just stress or all in their head, though our understanding has evolved considerably in recent decades. The hallmark of IBS is recurrent abdominal pain or discomfort that typically relates to bowel movements in some way. Many people notice that pain improves after having a bowel movement, or that the onset of pain coincides with changes in how often they go to the bathroom or in the appearance of their stool. Bloating and abdominal distension are also extremely common, with many patients reporting that they look several months pregnant by the end of the day, despite having a flat stomach in the morning. What makes IBS particularly complex is that it manifests differently from person to person. Doctors typically classify IBS into different subtypes based on predominant bowel patterns. IBS with diarrhea, IBSD, involves frequent loose, watery stools and affects about 1/3 of patients. These individuals often describe a sense of urgency and worry about having quick access to bathrooms. IBS with constipation, IBSC, involves infrequent hard stools that can be difficult to pass, affecting another 1/3 of patients. Many people experience IBS with mixed bowel habits, IBSM, alternating between diarrhea and constipation, sometimes even within the same day. A smaller percentage have unclassified patterns that don't fit neatly into these categories. Beyond these primary symptoms, many people with IBS report additional digestive complaints, including excessive gas, nausea, and a feeling of incomplete evacuation after bowel movements. Many also experience non-digestive symptoms like fatigue, sleep disturbances, headaches, and urinary symptoms. In fact, IBS frequently overlaps with other conditions, including fibromyalgia, chronic fatigue syndrome, temporomandibular joint disorders, and certain mental health conditions like anxiety and depression. This constellation of overlapping conditions has led researchers to investigate shared underlying mechanisms. While the exact cause of IBS remains incompletely understood, research has revealed several key factors that contribute to its development. One significant breakthrough has been understanding the role of the gut-brain axis, that bidirectional communication network between our digestive system and central nervous system we touched on earlier. In IBS, this communication appears to be dysregulated, with heightened sensitivity to signals from the digestive tract reaching the brain. This leads to what doctors call visceral hypersensitivity. Essentially, the nerves in the digestive tract become overly responsive to normal stimuli. Something that wouldn't bother most people, like the normal contractions of intestinal muscles after eating or modest amounts of gas, can trigger significant pain in someone with IBS. It's almost as if the volume is turned up too high on pain signals from the gut. Another key factor in many IBS cases involves disruptions to gut motility, the coordinated muscle contractions that move food through the digestive tract. Some people with IBS experience faster than normal transit time, contributing to diarrhea, while others have slower than normal movement, leading to constipation. These motility changes can be triggered by various factors including certain foods, stress, hormonal fluctuations, and alterations in gut bacteria. Speaking of bacteria, the gut microbiome appears to play a significant role in IBS for many patients. Studies have found differences in the microbial composition between people with and without IBS. Some research indicates that certain IBS symptoms may result from imbalances in gut bacteria or inappropriate immune responses to normal gut microbes. This connection is particularly evident in people who develop IBS following a bout of gastroenteritis, post-infectious IBS, which affects 7 to 8% of people who experience food poisoning or stomach bugs. Genetic factors also contribute to IBS susceptibility, with studies of twins suggesting that heredity accounts for about 25 to 30% of IBS risk. Various genetic variations affecting neurotransmitter activity, immune function, and intestinal barrier integrity have been identified in IBS patients. However, environmental factors clearly play a major role as well. Among these environmental influences, stress and psychological factors stand out as significant contributors. While stress doesn't cause IBS, it certainly can trigger flare-ups and worsen symptoms. The relationship works both ways. IBS symptoms can also increase stress levels, potentially creating a difficult cycle. Early life stress and trauma appear to increase vulnerability to developing IBS later in life, possibly by affecting how the gut-brain connection develops. Diagnosing IBS remains challenging because there's no single test that can confirm it. Instead, doctors typically use what's called a positive diagnostic approach, looking for characteristic symptoms while ruling out other potential causes. The Rome-4 criteria, developed by international experts, provide a framework for diagnosis. These criteria require recurrent abdominal pain at least 1 day per week over the past 3 months, associated with at least 2 of the following: pain related to defecation, change in stool frequency, or change in stool appearance. Your doctor might recommend certain tests to rule out other conditions that can mimic IBS symptoms. These might include blood tests to check for celiac disease, inflammatory markers, or thyroid problems, stool tests to look for infections or inflammatory bowel disease, and in some cases, a colonoscopy, especially for patients over age 45 or those with warning signs like weight loss, rectal bleeding, or family history of colon cancer. Once diagnosed, managing IBS typically requires a multi-pronged approach tailored to each individual's specific symptoms and triggers. Dietary modifications often play a central role in treatment. Many patients find that certain foods consistently trigger symptoms, though these vary widely between individuals. Common culprits include dairy products, wheat, certain fruits and vegetables, spicy foods, fatty foods, and caffeine. One dietary approach that has gained substantial scientific support is the low FODMAP diet. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Quite a mouthful, I know. These are specific types of carbohydrates that can be poorly absorbed in the small intestine, leading to increased water being drawn into the bowel and rapid fermentation by gut bacteria, causing gas, bloating, and altered bowel habits. Research shows that following a low FODMAP diet reduces symptoms in about 70% of IBS patients. The diet typically involves 3 phases. First, eliminating all high FODMAP foods for 2 to 6 weeks, then systematically reintroducing categories of FODMAPs to identify personal triggers, and finally developing a personalized long-term eating plan that restricts only problematic FODMAPs. Because the diet is complex and somewhat restrictive, working with a registered dietitian with expertise in digestive health is highly recommended. Beyond dietary management, various medications can help address specific IBS symptoms. For IBS-D, options include antidiarrheals like loperamide, antispasmodics to reduce gut cramping, bile acid sequestrants for those with bile acid malabsorption, and newer agents like aluxatoline that reduce both diarrhea and abdominal pain. For IBS-C, fiber supplements, osmotic laxatives, and prescription medications like linaclotide or lubiprostone can help restore more regular bowel movements. Certain antidepressants, particularly tricyclic antidepressants and selective serotonin reuptake inhibitors, SSRIs, are sometimes used at low doses to address pain and gut motility issues, even in patients without depression. The gut-brain connection in IBS makes stress management an essential component of treatment. Techniques that have shown benefit include cognitive behavioral therapy, gut-directed hypnotherapy, mindfulness meditation, and relaxation training. Regular physical activity also helps regulate bowel function and reduce stress, with studies showing improvements in IBS symptoms with moderate exercise. Probiotics represent another treatment option, though results vary considerably depending on the specific strains used. Some studies show certain probiotic formulations can reduce bloating, gas, and abdominal pain, but finding the right one often involves trial and error. Research continues to refine our understanding of which specific probiotic strains work best for different IBS subtypes. For many people with IBS, pacing is important, both literal physical pacing of activities and figurative pacing of life's demands. Many patients report that scheduling adequate rest, avoiding overscheduling, and building in buffer time to manage unexpected symptom flare-ups helps maintain better control of their condition. What's particularly encouraging is that our understanding of IBS continues to evolve rapidly, with new treatments emerging from ongoing research. Gut-directed hypnotherapy shows particular promise, with effectiveness rates comparable to dietary and pharmaceutical approaches in clinical trials. Fecal microbiota transplantation, while still experimental for IBS, has shown preliminary promise in some studies. Targeted probiotics designed specifically for different IBS subtypes are under development. Despite these advances, living with IBS remains challenging for many. The unpredictable nature of symptoms can affect work, social activities, travel, and intimate relationships. The invisibility of the condition means that others often don't understand the impact it can have on daily life. Support groups, both online and in person, provide valuable validation and practical tips for coping. The good news is that while IBS is chronic, it's not progressive or life-threatening. Many people find that with appropriate management strategies, they can gain substantial control over their symptoms and minimize the condition's impact on their quality of life. The key lies in working with knowledgeable healthcare providers to develop a personalized approach that addresses your specific symptoms, triggers, and circumstances. With patience and persistence, most people with IBS can find significant relief and return to enjoying daily activities with greater comfort and confidence. While IBS can be effectively managed with personalized approaches, there are other digestive disorders that often get confused with it but are quite different in nature. Unlike IBS, which doesn't involve visible damage to the digestive tract, inflammatory bowel disease, commonly known as IBD, represents a group of conditions characterized by chronic inflammation of the digestive tract that can lead to permanent damage over time. Understanding the role of diet in these more serious inflammatory conditions has become increasingly important in their treatment and management. IBD primarily includes two main conditions: Crohn's disease and ulcerative colitis. Though they share some similarities, they affect the digestive tract in different ways. Ulcerative colitis specifically causes inflammation and ulcers in the innermost lining of the colon and rectum. The inflammation typically begins in the rectum and lower colon but may spread continuously to involve the entire colon. Crohn's disease, on the other hand, can affect any part of the digestive tract from mouth to anus, though it most commonly affects the end of the small intestine and the beginning of the colon. Unlike ulcerative colitis, Crohn's disease involves patches of inflammation that may extend through multiple layers of the intestinal wall, with healthy tissue in between affected areas. Both conditions share symptoms like diarrhea, abdominal pain, fatigue, and weight loss, but they can also cause more serious complications, including intestinal bleeding, malnutrition, and in severe cases, life-threatening emergencies. These conditions affect approximately 3 million Americans, with onset typically occurring between ages 15 and 30, though IBD can develop at any age. While the exact causes remain incompletely understood, research points to a combination of genetic predisposition, environmental factors, and an abnormal immune response that mistakenly attacks the digestive tract. Historically, diet wasn't considered a primary treatment for IBD, with the focus placed almost exclusively on medication to control inflammation and, when necessary, surgery to remove damaged portions of the digestive tract. However, in recent years, nutritional therapy has emerged as both a complementary and, in some cases, primary approach for managing IBD symptoms and achieving remission, particularly in certain patient populations. The connection between food and IBD is complex and multifaceted. On one hand, the chronic inflammation characteristic of IBD can affect how the body digests and absorbs nutrients from food. On the other hand, certain food components may trigger or worsen inflammation in susceptible individuals. Additionally, the gut microbiome, which, as we've discussed, plays crucial roles in health and disease, is significantly altered in IBD patients, and diet directly shapes this microbial community. One of the most well-studied dietary interventions for IBD is what's called exclusive enteral nutrition, or EEN. This approach involves consuming all calories from a liquid formula diet for a period typically ranging from 6 to 8 weeks, with no regular food consumed during this time. While it might sound extreme, EEN has demonstrated remarkable effectiveness for inducing remission in Crohn's disease, particularly in children and adolescents. Studies show success rates comparable to corticosteroids, which have traditionally been first-line therapy for flare-ups, but without the significant side effects that steroids can cause. EEN appears to work through multiple mechanisms. It provides easily digestible nutrition that reduces digestive workload, eliminates potential dietary triggers, modifies the gut microbiome, and has direct anti-inflammatory effects on the intestinal lining. For children with Crohn's disease, EEN is now recommended as first-line therapy for inducing remission in many countries, though it remains somewhat underutilized in the United States. While EEN is most effective in Crohn's disease, particularly when it affects the small intestine, it has shown less consistent results for ulcerative colitis. The challenge with EEN is that it's difficult for many patients to maintain long-term, and symptoms often return once regular food is reintroduced. This has led to the development of partial enteral nutrition approaches, where specialized formula provides a portion of daily calories while allowing some regular food consumption. This more flexible approach may help maintain remission over longer periods, though it's generally not as effective as EEN for inducing initial remission during active disease. Beyond enteral nutrition, several specific dietary patterns have shown promise for IBD management. The specific carbohydrate diet, or SCD, eliminates most complex carbohydrates and processed foods based on the theory that these foods feed harmful bacteria in the gut, contributing to inflammation. The diet allows proteins, fats, and simple carbohydrates from fruits, non-starchy vegetables, and honey, while eliminating grains, most dairy, sugars, and processed foods. Several small studies and case reports have shown promising results with the SCD for both Crohn's disease and ulcerative colitis, with some patients achieving significant symptom improvement and even remission. More recently, researchers have developed the Crohn's disease exclusion diet, or CDED, which focuses on excluding specific foods believed to negatively affect the intestinal environment, including certain additives, processed meats, dairy, wheat, and high-fat foods. This diet is typically implemented alongside partial enteral nutrition in a phased approach. Early research has shown impressive results, with one study finding that 78% of children and adolescents achieved remission after 12 weeks on the combined CDED and partial enteral nutrition protocol. The Mediterranean diet pattern, characterized by high consumption of fruits, vegetables, whole grains, olive oil, fish, and limited red meat, has also shown potential benefits for IBD patients. Its emphasis on anti-inflammatory foods rich in polyphenols, omega-3 fatty acids, and fiber may help reduce systemic inflammation and support a healthier gut microbiome composition. Some studies suggest that higher adherence to a Mediterranean dietary pattern is associated with lower risk of IBD flares and better quality of life for those with the condition. Low FODMAP approaches, which we discussed for IBS management, sometimes provide symptom relief for IBD patients during periods of remission, though they don't appear to address the underlying inflammation during active disease. It's worth noting that very restrictive low FODMAP diets may actually be counterproductive in IBD by reducing intake of beneficial prebiotic fibers that support gut health, so they're typically recommended only for short-term symptom management rather than long-term use. Beyond specific dietary patterns, certain individual nutrients deserve special attention in IBD. Malnutrition is a common complication, affecting 40 to 50% of patients with IBD at some point during their disease. Multiple factors contribute to this nutritional risk. Inflammation can reduce appetite while increasing caloric needs. Diarrhea accelerates loss of nutrients. Inflammation reduces the absorptive capacity of the intestine, and many patients restrict their diet in attempts to control symptoms, sometimes eliminating important food groups. Iron deficiency is particularly common, affecting up to 60% of patients with IBD. This results from a combination of blood loss through the inflamed intestine and reduced iron absorption due to inflammation. Symptoms of iron deficiency include fatigue, weakness, and reduced exercise tolerance, complaints that significantly impact quality of life. While iron supplements can help, they sometimes worsen digestive symptoms, so intravenous iron is often preferred, especially during disease flares. Vitamin D deficiency also affects many IBD patients and may contribute to disease activity. Vitamin D plays important roles in regulating the immune system and maintaining the intestinal barrier, both relevant to IBD pathophysiology. Regular monitoring of vitamin D levels and supplementation when needed is increasingly recognized as an important aspect of comprehensive IBD care. Protein requirements are typically higher for those with IBD, particularly during active inflammation, yet protein intake is often inadequate. Ensuring sufficient protein from sources that don't exacerbate symptoms is crucial for tissue repair, immune function, and preventing muscle loss. For some patients, protein supplements provide a useful way to meet these increased needs without increasing overall food volume. Vitamin B12 deserves special mention for patients with Crohn's disease affecting the terminal ileum, the last section of the small intestine, as this is the only site where B12 can be absorbed. Surgical removal of this section, which is sometimes necessary in Crohn's disease, creates a permanent need for B12 supplementation, typically given by injection. The practical implementation of nutritional therapy for IBD requires individualization and careful monitoring. Working with a registered dietitian who specializes in IBD is highly valuable. These specialists can help identify nutritional deficiencies, develop personalized eating plans that avoid trigger foods while ensuring nutritional adequacy, and guide patients through more structured interventions like EEN or specific therapeutic diets when appropriate. It's worth emphasizing that dietary management should complement, not replace, conventional medical therapy for most patients with IBD. The goal is to optimize nutrition status, reduce symptoms, potentially reduce medication requirements, and improve quality of life. Regular communication between gastroenterologists and nutrition professionals helps ensure coordinated care. For patients experiencing a disease flare, certain dietary modifications often help reduce symptoms while the inflammation is being addressed. These typically include avoiding high-fiber foods temporarily, as fiber can aggravate symptoms during active inflammation, choosing smaller, more frequent meals, ensuring adequate hydration, limiting caffeine and alcohol, and avoiding very fatty foods, which can worsen diarrhea. During periods of remission, the focus shifts to supporting overall nutritional status, preventing deficiencies, and potentially reducing the risk of future flares. A diet rich in plant diversity supports a healthy gut microbiome, though fiber should be increased gradually if the patient has been limiting it. Fatty fish containing omega-3 fatty acids may have anti-inflammatory benefits. Fermented foods like yogurt and kefir provide probiotics that may support gut health, though individuals need to assess their personal tolerance. Looking toward the future, research into diet and IBD is expanding rapidly. The DINE-CD study currently underway is comparing the Mediterranean diet to the specific carbohydrate diet in Crohn's disease patients to determine their relative effectiveness. Other researchers are exploring personalized nutrition approaches based on genetic factors, microbiome composition, and biomarkers that might predict individual responses to specific dietary interventions. The growing recognition of diet's role in IBD represents a significant shift in how we approach these complex conditions. While medications remain the foundation of treatment for many patients, nutritional therapy offers additional avenues for symptom control, reduced inflammation, and improved quality of life. For some patients, particularly children with Crohn's disease, diet-based approaches may even serve as primary therapy, potentially delaying or reducing the need for immunosuppressive medications with their associated side effects. The evolving understanding of how food interacts with our genes, microbiome, immune system, and intestinal barrier in IBD holds promise for increasingly targeted nutritional recommendations in the future. Rather than one-size-fits-all approaches, we're moving toward more personalized nutritional strategies that consider the unique characteristics of each patient's disease, nutritional status, and individual response to various foods. This integration of nutritional science with traditional medical approaches represents an encouraging development for the millions of people worldwide living with these challenging digestive conditions. While personalized nutrition approaches for conditions like IBD continue to advance, it's important to recognize that proper digestion isn't just about the foods we choose. It's also about how effectively our bodies can break down those foods into usable nutrients. This is where digestive enzymes come into play. These remarkable proteins serve as the body's natural food processors, breaking down complex food molecules into smaller components that can be absorbed through the intestinal wall and used by our cells. Digestive enzymes are specialized proteins that act as biological catalysts, meaning they speed up chemical reactions in the body without being consumed in the process. Each enzyme has a specific job, working like a key that fits only one lock. This specificity is what allows our digestive system to efficiently process the wide variety of foods we consume daily. The digestion process actually begins before we even take our first bite. Just the sight, smell, or thought of food triggers the salivary glands to release an enzyme called amylase. This enzyme starts breaking down starches into simpler sugars right in your mouth. That's why if you chew bread for long enough, you'll notice it starts to taste slightly sweet. That's amylase converting starch to sugar in real time. Once food reaches the stomach, it encounters a highly acidic environment where an enzyme called pepsin begins breaking down proteins into smaller peptides. The stomach also produces lipase to start fat digestion, though stomach lipase plays a relatively minor role compared to pancreatic lipase, which we'll discuss in a moment. The small intestine is where the majority of enzymatic digestion takes place. When partially digested food enters the small intestine from the stomach, it triggers the release of secretin and cholecystokinins, hormones that signal the pancreas to release its powerful digestive enzymes. The pancreas, a fish-shaped organ that sits behind the stomach, is essentially an enzyme factory, producing about 2 cups of enzyme-rich fluid daily. The pancreatic enzymes include amylase, which continues the breakdown of starches, lipase, which breaks down fats into fatty acids and glycerol, and various proteases like trypsin and chymotrypsin, which continue protein digestion. The pancreas also produces nucleases that break down nucleic acids from foods containing DNA and RNA. Meanwhile, the gallbladder releases bile, which isn't technically an enzyme, but plays a crucial role in digestion by emulsifying fats, essentially breaking large fat globules into smaller droplets, creating more surface area for lipase to work on. This is particularly important because enzymes are water-soluble while fats are not, so emulsification helps bridge this gap. The small intestine itself produces additional enzymes within the brush border, the microvilli-covered surface of intestinal cells. These enzymes include lactase, which breaks down lactose, the sugar in milk, sucrase, which breaks down sucrose or table sugar, maltase, which breaks down maltose from digested starch, and various peptidases that complete protein digestion by breaking down small peptides into individual amino acids. This synchronized enzyme production across multiple organs represents one of the body's most sophisticated systems. When working properly, these enzymes allow us to extract nutrients from virtually any food we consume, converting complex molecules into absorbable components, proteins into amino acids, carbohydrates into simple sugars, and fats into fatty acids and glycerol. However, various conditions can interfere with this finely tuned system, leading to enzyme deficiencies and digestive difficulties. Perhaps the most severe enzyme deficiency involves the pancreas. Pancreatic insufficiency occurs when the pancreas doesn't produce enough digestive enzymes, most commonly due to chronic pancreatitis, pancreatic inflammation, cystic fibrosis, pancreatic cancer, or following pancreatic surgery. People with pancreatic insufficiency typically experience steatorrhea, fatty, loose, pale, and particularly foul-smelling stools that may float in the toilet due to their high fat content. They often lose weight despite eating well because they can't properly absorb nutrients. Abdominal pain, bloating, and gas are common complaints. Because multiple enzymes are affected, people with pancreatic insufficiency have difficulty digesting all macronutrients, proteins, fats, and carbohydrates. Another common enzyme deficiency affects just one enzyme, lactase. Lactose intolerance affects approximately 65% of the global population, with rates varying widely by ethnic background. Most mammals, including humans, naturally produce lactase during infancy to digest milk sugar. However, many people experience a genetically programmed decrease in lactase production after weaning, typically becoming noticeable between ages 2 and 12. When someone with lactase deficiency consumes dairy products, the undigested lactose passes into the large intestine, where gut bacteria ferment it, producing gas, bloating, abdominal pain, and diarrhea. Symptoms typically appear 30 minutes to 2 hours after consuming dairy. Interestingly, lactose intolerance isn't an all-or-nothing phenomenon. Many people with reduced lactase can tolerate small amounts of dairy or certain dairy products like yogurt and aged cheeses, which contain less lactose than milk. Beyond these well-defined deficiencies, some people experience what might be called relative enzyme insufficiency. They produce enzymes but not quite enough to meet their digestive demands. This can result from aging. Enzyme production naturally declines with age, chronic stress, which diverts resources away from digestion, certain medications, alcohol consumption, or various digestive conditions that affect the gut environment. For those with confirmed enzyme deficiencies, enzyme supplementation can be transformative. The most established use is prescription-strength pancreatic enzyme replacement therapy (PERT) for people with pancreatic insufficiency. These prescription products contain a standardized mixture of pancreatic enzymes, typically obtained from pig pancreas. They are specially coated to resist stomach acid, allowing the enzymes to reach the small intestine where they're needed. Proper dosing of pancreatic enzyme supplements is crucial. Too little won't effectively treat symptoms, while too much can cause side effects like constipation, nausea, or abdominal cramps. Dosing is typically based on body weight and the fat content of meals, with higher fat meals requiring more enzymes. People using these supplements learn to adjust their dosage based on meal size and composition. For those with lactose intolerance, lactase supplements taken just before consuming dairy can help prevent symptoms. These supplements provide the missing enzyme needed to break down lactose in the small intestine before it reaches the colon, where it would cause problems. Over-the-counter lactase supplements are widely available and generally considered very safe, though their effectiveness varies between brands and individuals. Beyond these medically recognized uses, digestive enzyme supplements have become increasingly popular for general digestive support and for conditions like IBS, bloating, and gas. These supplements typically contain a broader range of enzymes, often derived from plant sources like pineapple, which contains bromelain, papaya, which contains papain, or from fungi. Unlike prescription pancreatic enzymes, these over-the-counter products aren't regulated as drugs but as dietary supplements, which means less standardization and oversight. The evidence for these broader applications is mixed and generally less robust than for specific deficiencies like pancreatic insufficiency or lactose intolerance. Some small studies suggest benefits for conditions like IBS, but larger, more rigorous studies are needed. That said, many people report subjective improvements in symptoms like bloating and gas when taking comprehensive enzyme supplements with meals. One emerging area of interest involves using specific enzymes to help with difficult-to-digest proteins like gluten. Products containing enzymes that break down gluten are sometimes marketed to people with gluten sensitivity. While these may help reduce symptoms from accidental small exposures, it's important to note that they're not considered safe for people with celiac disease, as they don't completely eliminate gluten. If you're considering enzyme supplements, there are several factors to keep in mind. First, quality varies widely between products. Look for reputable manufacturers that perform independent testing and can provide information about the activity units of each enzyme, a measure of how much digesting power the enzyme has, which is more important than the simple weight amount. Timing is crucial for enzyme supplements. They should be taken at the beginning of a meal or at the latest during the meal. Taking them after you've finished eating significantly reduces their effectiveness, as they need to be physically present with the food to work on it. The form of the supplement matters too. Some enzymes are vulnerable to stomach acid, so they may be more effective in capsules with special coatings that protect them until they reach the small intestine. Others work well throughout the digestive tract and don't require special protection. For most people without specific diagnosed deficiencies, starting with a broad-spectrum digestive enzyme that includes a variety of enzymes for different food components makes sense. If you notice certain foods consistently cause problems, you might later try more targeted enzyme support, like lipase for fatty foods or alpha-galactosidase for beans and gas-producing vegetables. It's worth noting that while digestive enzymes are generally considered safe, they aren't appropriate for everyone. People with certain health conditions, particularly acute pancreatitis, should avoid enzyme supplements unless specifically prescribed by their doctor. Some enzyme supplements may interact with medications, including blood thinners and diabetes medications. As with any supplement, it's wise to consult with a healthcare provider before starting enzyme supplementation, especially if you have existing health conditions. From a long-term perspective, while enzyme supplements can be helpful tools, addressing the underlying causes of digestive difficulties is equally important. This might involve identifying and managing stress, treating underlying conditions like SIBO, small intestinal bacterial overgrowth, or IBD, improving eating habits like thoroughly chewing food and not eating on the run, or working with a nutritionist to identify problematic foods. Some lifestyle practices may naturally support enzyme production. Chewing thoroughly not only mechanically breaks down food, but also stimulates saliva production with its enzymes. Bitter foods and herbs consumed before meals can stimulate digestive secretions, including enzymes. Fermented foods like sauerkraut, kimchi, and yogurt contain beneficial bacteria that may aid digestion and, in some cases, provide additional enzymes. Ultimately, whether you're dealing with a diagnosed enzyme deficiency or more general digestive complaints, understanding the role of digestive enzymes provides another tool for optimizing your digestive health. The right enzymes, taken at the right time, can make a significant difference in how well you digest and absorb nutrients from your food, turning the old saying, "you are what you eat," into the more accurate, "you are what you digest and absorb." Proper digestion isn't just about efficiently breaking down nutrients. There's a fascinating connection between our digestive system and another crucial part of our body that affects virtually every aspect of our lives. Have you ever experienced butterflies in your stomach when nervous, or felt nauseated during times of intense stress? These common experiences hint at something scientists have been investigating with increasing interest: the intricate communication network between our gut and our brain. This connection, often called the gut-brain axis, represents one of the most fascinating frontiers in health research. We're discovering that the relationship between our digestive system and our mental well-being runs much deeper than previously thought. It's not just a one-way street with our brain influencing our digestion. Our gut actually sends signals back to our brain that can influence mood, cognition, and even mental health conditions. The communication system between gut and brain is remarkably complex and operates through several different pathways simultaneously. The most direct physical connection is through the vagus nerve, the longest cranial nerve in the body. This nerve serves as an information superhighway, transmitting signals in both directions. About 80 to 90% of the nerve fibers in the vagus nerve actually carry information from the gut to the brain, not the other way around, meaning your gut is constantly sending messages to your brain about what's happening in your digestive system. Beyond this neural connection, the gut and brain also communicate through immune system signaling. The gut houses approximately 70 to 80% of your immune tissue in what's known as gut-associated lymphoid tissue, or GALT. When inflammation occurs in the gut, whether from infection, food sensitivities, or disruptions in the microbiome, immune cells release signaling molecules called cytokines that can travel throughout the body, including to the brain. Some of these inflammatory signals can affect brain function, potentially influencing mood and behavior. Hormones provide another communication channel between gut and brain. Your digestive system is actually the largest endocrine hormone-producing organ in your body, releasing dozens of different hormones that influence everything from appetite and satiety to stress responses and mood. Gut hormones like cholecystokinin, ghrelin, and peptide YY not only regulate digestion but also affect brain regions involved in motivation, pleasure, and anxiety. Perhaps most fascinating is the role of the gut microbiome in this communication network. The trillions of bacteria in your intestines produce numerous neuroactive compounds, substances that can influence brain function. These include neurotransmitters like serotonin, dopamine, and GABA, the same chemicals targeted by many psychiatric medications. In fact, gut bacteria produce approximately 90 to 95% of the body's serotonin, often called the happiness chemical, for its role in regulating mood. These bacteria also produce short-chain fatty acids like butyrate, acetate, and propionate through the fermentation of dietary fiber. These compounds not only nourish the cells lining your intestines, but can also influence brain health and function. They help maintain the integrity of the blood-brain barrier, reduce neuroinflammation, and may even stimulate the production of brain-derived neurotrophic factor, BDNF, a protein that supports the survival and growth of brain cells. Given these multiple lines of communication, it's not surprising that disruptions in gut health can affect mental well-being. Research has found correlations between gut dysbiosis, an imbalance in the gut microbial community, and various mental health conditions. For example, several studies have found different microbiome compositions in people with depression compared to those without. These differences aren't just coincidental. When researchers have transferred gut bacteria from depressed humans into germ-free animals, the animals developed behaviors resembling depression. Similar associations have been found with anxiety disorders. People with anxiety often show lower levels of beneficial bacterial species like bifidobacteria and lactobacilli, and higher levels of potentially problematic bacteria. The connection appears to be bidirectional. Anxiety can alter gut function, and gut disturbances can increase anxiety. The gut-brain connection extends to other conditions as well. Some research has found altered gut bacteria in people with autism spectrum disorders, and there are often overlapping digestive symptoms. Children with autism frequently experience gastrointestinal issues like constipation, diarrhea, and abdominal pain at much higher rates than their neurotypical peers. While this doesn't mean gut bacteria cause autism, it suggests that addressing gut health might help manage some associated symptoms. Even neurodegenerative conditions like Parkinson's disease show connections to gut health. Intriguingly, constipation and other digestive symptoms often appear years before the motor symptoms of Parkinson's, and some research suggests that the alpha-synuclein protein deposits characteristic of the disease might actually begin in the gut's nervous system before spreading to the brain. The communication goes both ways, of course. Mental states like stress, anxiety, and depression can significantly impact digestive function. When you're stressed, your body activates the fight or flight response, diverting resources away from digestion to prepare for dealing with a threat. This can slow digestive motility, the movement of food through your digestive tract, decrease enzyme production, alter blood flow to the digestive organs, and change the composition of your gut bacteria, all within minutes to hours of experiencing stress. Chronic stress can be particularly damaging to gut health. The persistent elevation of stress hormones like cortisol can increase intestinal permeability, sometimes called leaky gut, where the tight junctions between intestinal cells become compromised, potentially allowing partially digested food particles, bacteria, and toxins to enter the bloodstream. This can trigger immune responses and inflammation that may further affect both gut and brain function. This relationship creates the potential for a vicious cycle. Psychological stress disrupts gut function, which alters microbiome composition and increases inflammation, which then sends signals to the brain that can worsen mood and anxiety, creating more stress. Breaking this cycle often requires addressing both mental health and gut health simultaneously. So what practical steps can you take to support this crucial connection? Diet stands out as one of the most powerful tools. The foods you eat directly shape your microbiome composition within days to weeks. A diet rich in diverse plant foods provides fiber that beneficial bacteria need to thrive and produce those important neuroactive compounds and short-chain fatty acids. Foods particularly beneficial for gut-brain health include fermented foods like yogurt, kefir, sauerkraut, and kimchi, which contain live beneficial bacteria. A Stanford University study found that a diet high in fermented foods increased microbiome diversity and reduced markers of inflammation. Prebiotic-rich foods that feed beneficial bacteria, including garlic, onions, leeks, asparagus, bananas, oats, and legumes. These foods contain specific types of fiber that beneficial bacteria particularly love to ferment. Omega-3 rich foods like fatty fish, walnuts, and flax seeds, which have anti-inflammatory properties that may benefit both the gut and the brain. The brain is about 60% fat, and omega-3 fatty acids are crucial components of brain cell membranes. Colorful fruits and vegetables rich in polyphenols, plant compounds with antioxidant properties that can also act as food for beneficial gut bacteria. Berries, citrus fruits, dark chocolate, green tea, and red wine contain particularly high levels of these beneficial compounds. Beyond diet, managing stress plays a crucial role in supporting the gut-brain connection. Practices like meditation, deep breathing, yoga, and regular exercise have all been shown to positively affect both brain function and gut health. Exercise in particular appears to increase microbiome diversity while also boosting mood through multiple mechanisms. Adequate sleep is another fundamental factor. Sleep disruption can alter microbiome composition within just 2 days, while also increasing stress hormones and inflammation. Most adults need 7 to 9 hours of quality sleep for optimal gut and brain health. Limiting unnecessary antibiotic use helps protect your microbiome from major disruptions. While antibiotics are sometimes necessary and life-saving, they don't discriminate between harmful and beneficial bacteria. If you do need antibiotics, consider asking your healthcare provider about concurrent probiotic use and focus on microbiome-supporting foods during and after treatment. An emerging area of research focuses on psychobiotics, specific bacterial strains that, when ingested in adequate amounts, may produce mental health benefits. While the field is still young, certain strains including Lactobacillus acidophilus, Lactobacillus casei, Bifidobacterium bifidum, and Bifidobacterium longum have shown promising results in reducing anxiety and depression symptoms in some studies. If you're experiencing significant mental health challenges alongside digestive symptoms, consider working with healthcare providers who understand the gut-brain connection. This might include practitioners like integrative physicians, functional medicine doctors, or conventional providers who stay current with this rapidly evolving field. A combined approach addressing both gut health and mental health directly often yields better results than focusing on either aspect alone. While the connection between gut health and mental well-being is compelling, it's important to maintain realistic expectations and a balanced perspective. Improving your gut health won't necessarily cure serious mental health conditions, and the quality of research varies considerably across different conditions and interventions. Many studies show correlations rather than causation, and much of the research is still in early stages. That said, the gut-brain connection represents a promising complementary approach to supporting mental well-being, particularly when combined with other evidence-based mental health strategies. What makes this field so exciting is that it opens up new avenues for understanding and addressing mental health. Approaches that don't necessarily replace traditional treatments but can work alongside them to improve outcomes. It also empowers individuals with additional tools for supporting their mental well-being through dietary and lifestyle choices that benefit both gut and brain health. As research in this area continues to evolve, we're likely to develop increasingly sophisticated approaches to harnessing the gut-brain connection for better mental health. This might include personalized interventions based on individual microbiome testing, specific psychobiotic formulations targeted to particular conditions, and combination therapies that address multiple aspects of the gut-brain axis simultaneously. For now, the fundamental approaches of eating a diverse plant-rich diet, managing stress, prioritizing sleep, and staying physically active provide a solid foundation for supporting this crucial connection between your digestive system and your mental well-being. The complex relationship between gut health and mental well-being points to something many people experience but don't always recognize. Our bodies often communicate discomfort through multiple interconnected systems. One particularly common source of both physical and mental distress comes from adverse reactions to foods. Have you ever eaten a meal and then found yourself feeling unwell afterward, but weren't sure exactly what caused it? You might have experienced a food intolerance or sensitivity, conditions that affect millions of people but are often misunderstood, misdiagnosed, or missed entirely. Food intolerances and sensitivities differ fundamentally from true food allergies, though the terms are frequently confused. A true food allergy involves the immune system's immunoglobulin E, IgE antibodies, and can trigger immediate, potentially life-threatening reactions like anaphylaxis. Think of someone with a severe peanut allergy who experiences throat swelling and breathing difficulties within minutes of exposure. That's an IgE-mediated allergic reaction. Food intolerances and sensitivities, on the other hand, typically involve delayed reactions that can occur hours or even days after eating the problematic food. These reactions don't engage the IgE-mediated immune response, making them less immediately dangerous but often more difficult to identify. They're also typically dose-dependent, meaning small amounts of the food might be tolerated while larger portions cause symptoms. Several different mechanisms can underlie food intolerances. One of the most straightforward is enzyme deficiency, with lactose intolerance being the classic example. Without sufficient lactase enzyme to break down the lactose in dairy products, this sugar passes undigested into the large intestine where gut bacteria ferment it, producing gas, bloating, pain, and diarrhea. Similar enzyme-related intolerances can occur with other sugars like fructose or sugar alcohols like sorbitol and xylitol. Another mechanism involves pharmacological reactions to naturally occurring chemicals in foods. Histamine intolerance is a prime example. Histamine occurs naturally in many fermented and aged foods like aged cheese, wine, fermented vegetables, and cured meats. Normally, we break down dietary histamine using an enzyme called diamine oxidase DAO. Some people have insufficient DAO activity, leading to symptoms when they consume high histamine foods. These symptoms can include headaches, flushing, hives, digestive issues, and even anxiety or sleep disruptions, highlighting again that connection between gut and brain function. Other food chemicals that commonly cause reactions include salicylates, related to aspirin, found in many fruits, vegetables, spices, and tea, amines in chocolate, citrus, and fermented foods, and glutamates in aged cheeses, tomatoes, and fermented products. Some people are sensitive to food additives like sulfites, MSG, or artificial colors and preservatives. Non-allergic immune responses represent another category of food sensitivities. These don't involve IgE antibodies but may involve other aspects of the immune system. Non-celiac gluten sensitivity falls into this category. People who experience symptoms when consuming gluten but don't have celiac disease or wheat allergy. Despite years of research, the exact mechanism behind non-celiac gluten sensitivity remains incompletely understood, though it may involve innate immune activation or reactions to other components in wheat besides gluten. FODMAP sensitivity, which has gained significant attention in recent years, involves reactions to fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, specific types of carbohydrates found in various foods. These carbohydrates can be poorly absorbed in the small intestine and then fermented by gut bacteria, causing symptoms particularly in people with irritable bowel syndrome. The symptoms of food intolerances and sensitivities can manifest throughout the body, not just in the digestive tract. Gastrointestinal symptoms are common, including bloating, gas, abdominal pain, diarrhea, or constipation. But many people also experience headaches or migraines, fatigue, brain fog, joint pain, skin issues like eczema or hives, sleep disturbances, and mood changes including anxiety and irritability. This wide range of potential symptoms combined with delayed onset after eating the triggering food makes these conditions particularly challenging to identify. Diagnosing food intolerances remains something of an inexact science. The gold standard approach is a systematic elimination challenge protocol. This typically involves removing suspected trigger foods completely for a period, usually 2 to 6 weeks, noting if symptoms improve, and then methodically reintroducing foods one at a time while monitoring for reactions. This process can be time-consuming and requires careful tracking, but it provides the most reliable information about individual food reactions. For some specific intolerances, medical tests are available. Lactose intolerance can be diagnosed through hydrogen breath testing, which measures hydrogen gas produced when undigested lactose is fermented by gut bacteria. Fructose malabsorption can be assessed through similar breath testing. Celiac disease testing involves blood antibody tests and, if positive, intestinal biopsy, though these tests only identify celiac disease, not non-celiac gluten sensitivity. Various commercial tests claim to identify food sensitivities, but many have significant limitations. IgG food antibody tests measure immune responses to food proteins, but the presence of IgG antibodies doesn't necessarily indicate a problematic reaction. It may simply show foods you eat regularly. Similarly, tests measuring leukocyte activation, hair analysis, muscle testing, or electrodermal testing for food sensitivities lack solid scientific validation. This doesn't mean they never provide useful information, but results should be interpreted cautiously and ideally confirmed through elimination challenge protocols. Once problematic foods are identified, management typically involves avoiding or limiting those foods. For some intolerances, complete avoidance is necessary. For others, it's more about finding your personal threshold, the amount you can consume without triggering symptoms. For enzyme-related intolerances, supplements can sometimes help. For instance, lactase enzyme supplements taken with dairy can allow some people with lactose intolerance to enjoy these foods without symptoms. Similar enzyme supplements exist for other carbohydrates like alpha-galactosidase for beans and gas-producing vegetables. For histamine intolerance, DAO enzyme supplements may reduce reactions to histamine-containing foods, though their effectiveness varies between individuals. Antihistamine medications sometimes help manage symptoms as well. For salicylate or amine sensitivities, there are unfortunately no equivalent enzyme supplements, making avoidance the primary strategy. The low FODMAP diet has proven particularly effective for managing IBS symptoms related to FODMAP sensitivity. This approach involves eliminating high FODMAP foods initially, then systematically reintroducing FODMAP subgroups to identify specific triggers and thresholds. Studies show that about 70% of people with IBS experience significant symptom improvement on this diet. However, it's worth noting that the initial elimination phase is quite restrictive and not intended for long-term use, as many high FODMAP foods are otherwise nutritious and support gut microbiome diversity. A critical aspect of managing food intolerances is balancing restriction with nutritional adequacy. Eliminating multiple food groups without proper planning can lead to nutritional deficiencies. This is particularly concerning with elimination diets found on the internet that recommend removing numerous foods without guidance for appropriate substitutions. Working with a registered dietitian with expertise in food sensitivities can help ensure you're meeting nutritional needs while avoiding trigger foods. For many people, food sensitivities aren't permanent. The gut can heal, enzyme production can improve, and tolerance may increase over time. This is especially true when underlying contributors to food sensitivity are addressed. These might include excessive stress, intestinal infections, small intestinal bacterial overgrowth (SIBO), intestinal permeability issues, or imbalances in the gut microbiome. Identifying and treating these underlying factors may allow for greater food tolerance over time. It's also worth noting that food sensitivities can change throughout life. They may emerge during times of stress or illness and improve when overall health improves. Hormonal changes can influence food tolerance, with some women noticing cyclical changes in sensitivity throughout their menstrual cycle or new sensitivities developing during pregnancy or menopause. Aging can also affect enzyme production and digestive function, potentially leading to new food intolerances later in life. The psychological impact of dealing with food sensitivities shouldn't be underestimated. Food is central to social connection, cultural identity, and daily pleasure. Having to scrutinize ingredients, explain dietary needs to others, or miss out on favorite foods can be emotionally challenging. Finding support through in-person or online communities of people with similar dietary restrictions can help with both practical strategies and emotional aspects of living with food sensitivities. For those who suspect food intolerances might be contributing to their symptoms, a stepwise approach is generally best. Start by keeping a detailed food and symptom journal for at least 2 weeks, noting everything you eat and drink along with any symptoms, their severity, and timing. Look for patterns that might suggest specific trigger foods. Common culprits include dairy, wheat, high FODMAP foods, alcohol, caffeine, and highly processed foods with multiple additives. If patterns emerge, consider a targeted elimination of suspected triggers rather than a highly restrictive diet removing multiple food groups at once. This makes the process more manageable and makes it easier to identify what's actually helping. After the elimination period, structured reintroduction helps clarify which foods are problematic and in what amounts. Throughout this process, focusing on what you can eat rather than what you can't helps maintain a positive relationship with food. Most people with food sensitivities can still enjoy a diverse, nutritious, and satisfying diet once they identify their specific triggers and thresholds. Many find that their overall relationship with food improves as they become more attuned to how different foods affect their body and learn to prepare meals that support their well-being. The science of food intolerances continues to evolve, with researchers developing better testing methods and deeper understanding of underlying mechanisms. Emerging areas include the role of the microbiome in food tolerance, genetic factors that influence individual responses to foods, and potential treatments that might allow people to consume problematic foods without symptoms. As our understanding grows, approaches to identifying and managing food sensitivities will likely become more precise, potentially allowing for more personalized and less restrictive dietary recommendations in the future. The science of food reactions continues to evolve, but interestingly, some symptoms people attribute to food sensitivities might actually be manifestations of another extremely common digestive condition. Have you ever experienced a burning sensation in your chest after eating, especially when lying down afterward? That fiery feeling, often called heartburn, is the most recognizable symptom of gastroesophageal reflux disease, or GERD. This condition affects up to 20% of people in Western countries, making it one of the most prevalent digestive disorders worldwide. Despite its commonality, GERD is frequently misunderstood. Many people assume it's simply a matter of producing too much stomach acid, but the reality is far more complex. At its core, GERD involves the inappropriate backflow of stomach contents, including acid, enzymes, and partially digested food, into the esophagus. Unlike the stomach, which has a specialized lining designed to withstand acid, the esophagus has minimal protection against these harsh substances. This exposure can cause inflammation, pain, and over time, potentially serious complications. The normal barrier that prevents this reflux is the lower esophageal sphincter, LES, a ring of muscle at the junction where the esophagus meets the stomach. This sphincter acts like a one-way valve that should remain closed except when you're swallowing. In people with GERD, this crucial barrier function becomes compromised. Several factors can contribute to this dysfunction. The sphincter might be inherently weak. It might relax at inappropriate times, or increased pressure in the abdomen might overcome even a normally functioning sphincter. A common structural issue that contributes to GERD is hiatal hernia, where a portion of the stomach pushes upward through the diaphragm. This anatomical change disrupts the natural pressure gradient that helps keep stomach contents where they belong. Approximately 50% of people with GERD have a hiatal hernia, though many people with small hernias never develop reflux symptoms. Other factors that can contribute to GERD include delayed gastric emptying, where food stays in the stomach longer than normal, increasing opportunities for reflux to occur. Visceral hypersensitivity, that heightened pain perception we discussed with IBS, also plays a role for many GERD patients, making them experience normal levels of acid exposure more painfully than others would. The symptoms of GERD extend beyond the classic heartburn sensation. Many people experience regurgitation, the backflow of stomach contents into the throat or mouth, often described as a sour or bitter taste. Some have difficulty swallowing or feel like food gets stuck in their throat. Chronic cough, hoarseness, sore throat, and even dental erosion can result from acid reaching the throat and mouth. Some people, particularly the elderly and those with asthma, might not experience heartburn at all, but instead have these extraesophageal symptoms as their primary complaint. making diagnosis more challenging. When GERD becomes chronic, it can lead to complications. Repeated acid exposure can cause esophagitis, inflammation of the esophageal lining. Over time, this inflammation can lead to ulcers, bleeding, and scarring that narrows the esophagus, causing food to get stuck. A more concerning potential complication is Barrett's esophagus, a condition where the normal esophageal lining changes to become more like intestinal tissue in response to chronic acid exposure. Barrett's esophagus increases the risk of esophageal cancer, though it's important to note that most people with GERD never develop this complication. The standard treatment approach for GERD has long centered around acid suppression, primarily through medications called proton pump inhibitors (PPIs) like omeprazole, esomeprazole, and pantoprazole. These medications work by blocking the final step of acid production in the stomach, reducing both the amount and acidity of stomach contents. They're undeniably effective for symptom relief, with success rates of 80 to 90% for healing esophagitis and controlling heartburn. However, growing concerns about long-term PPI use have emerged in recent years. While these medications are generally safe for most people, research has linked extended use to potential issues including nutrient deficiencies, particularly vitamin B12, calcium, magnesium, and iron, increased risk of certain infections like pneumonia, and C. difficile potential kidney problems and bone fractures. They may also alter the gut microbiome composition in ways that could have broader health implications. These concerns don't mean that everyone should avoid PPIs. For many people with severe GERD or complications like Barrett's esophagus, the benefits clearly outweigh potential risks. However, they do suggest that a more nuanced approach is warranted, particularly for milder cases, with consideration of other management strategies that might reduce or eliminate the need for long-term medication. Lifestyle modifications form the foundation of holistic GERD management, and for people with mild symptoms, these changes alone might provide sufficient relief. Weight management stands out as particularly important. Excess abdominal fat increases pressure in the abdomen, pushing stomach contents upward. Studies show that even modest weight loss can significantly reduce GERD symptoms in overweight individuals. How and when you eat matters significantly. Eating smaller, more frequent meals puts less pressure on the LES than large meals. Finishing dinner at least 3 hours before bedtime gives the stomach time to empty before you lie down, reducing nighttime reflux. Speaking of sleeping, elevating the head of your bed by 6 to 8 inches, not just using more pillows, which can actually worsen reflux by bending the body, uses gravity to help keep stomach contents where they belong during the night. Certain foods and beverages are known to trigger GERD symptoms in many people. Common culprits include fatty foods, which slow stomach emptying, spicy foods, citrus, tomato products, chocolate, coffee, carbonated beverages, and alcohol. Mint, while often thought of as soothing for digestion, can actually relax the LES and worsen reflux. Tobacco use also relaxes the LES while stimulating acid production, a double hit that makes quitting particularly beneficial for GERD sufferers. Tight clothing that compresses the abdomen can literally squeeze stomach contents upward, so looser-fitting garments may help reduce symptoms. Similarly, activities that increase abdominal pressure, like heavy lifting, certain yoga poses, or abdominal crunches, might need modification for people with troublesome GERD. For those whose symptoms aren't adequately controlled with lifestyle changes and medication, or who prefer to avoid long-term medication use, various surgical and endoscopic procedures offer additional options. The traditional surgical approach is fundoplication, where the upper portion of the stomach is wrapped around the lower esophagus to reinforce the LES. This can be performed as an open surgery but is now more commonly done laparoscopically through small incisions, reducing recovery time. Newer, less invasive options have emerged in recent years. Magnetic sphincter augmentation involves placing a ring of magnetic beads around the lower esophageal sphincter. The magnetic attraction between the beads helps keep the sphincter closed when you're not swallowing but allows food to pass normally. Transoral incisionless fundoplication, TIF, is an endoscopic procedure that reconstructs the valve between the stomach and esophagus without external incisions. These newer approaches generally involve easier recovery than traditional surgery, though long-term data on durability is still accumulating. Beyond conventional medical approaches, several integrative strategies show promise for GERD management. Melatonin supplementation has demonstrated surprising effectiveness in some studies. Besides its role in sleep regulation, melatonin is produced in large quantities by cells in the digestive tract and appears to help strengthen the LES and reduce acid production. Some research suggests that 3 milligrams of melatonin at bedtime can improve GERD symptoms comparably to low-dose PPIs for some patients. Specific probiotic strains might benefit GERD by improving digestive function, reducing inflammation, and potentially helping normalize pressure at the gastroesophageal junction. While research is still preliminary, probiotics represent a low-risk option that might provide additional benefits alongside other treatments. Traditional herbal remedies like deglycyrrhizinated licorice, DGL, slippery elm, and marshmallow root have long been used to soothe the digestive tract. DGL in particular has some research supporting its ability to promote mucus production that helps protect the esophageal lining. These natural approaches might be particularly helpful for mild cases or as complementary strategies alongside conventional treatment. Stress reduction deserves special mention when discussing GERD management. While stress doesn't cause GERD, it can exacerbate symptoms through multiple mechanisms, altering digestive secretions, affecting gastric emptying, increasing pain perception, and potentially leading to behaviors like stress eating or poor food choices that trigger reflux. Mind-body practices like meditation, deep breathing, and progressive muscle relaxation may help reduce symptom severity. Acupuncture has shown some benefit for GERD in clinical studies, potentially working through multiple mechanisms including regulating gastric acid secretion, improving gastric emptying, and modulating pain perception. While more research is needed, it represents another low-risk option that some patients find helpful. Regardless of which treatment approach you choose, it's important to work with healthcare providers who take GERD seriously and don't dismiss it as a minor inconvenience. Chronic reflux can significantly impact quality of life, disrupting sleep, limiting dietary choices, interfering with social activities, and causing persistent discomfort. It deserves thorough evaluation and a comprehensive management plan. If you're experiencing new or worsening reflux symptoms, certain red flags warrant prompt medical attention. These include difficulty swallowing, especially if it's progressively worsening, painful swallowing, unintentional weight loss, vomiting, especially with blood, or chest pain. While GERD is a common cause of chest discomfort, it's crucial to rule out cardiac issues, particularly if the pain radiates to your jaw or arm or is accompanied by shortness of breath or sweating. For the vast majority of people with GERD, a combination of targeted lifestyle modifications, judicious use of medications when needed, and possibly complementary approaches can provide excellent symptom control and prevent complications. The key lies in finding the right balance of interventions for your specific situation and severity level, rather than simply accepting chronic medication use as inevitable or, conversely, suffering through symptoms without seeking appropriate treatment. With the expanding range of options available today, most people with GERD can find a management approach that allows them to eat, sleep, and live comfortably. Managing reflux with the right combination of approaches can significantly improve quality of life. But beyond addressing specific digestive disorders, there are foundational elements of nutrition that benefit virtually everyone's digestive health. One of the most crucial, yet frequently overlooked components of a digestive-friendly diet is something remarkably simple: fiber. Have you ever wondered why health experts consistently emphasize the importance of fiber in our diets? This plant-based nutrient plays such a fundamental role in digestive health that it deserves special attention. Fiber stands out from other nutrients because our bodies don't actually digest it, at least not directly. Unlike proteins, fats, and most carbohydrates, which our digestive enzymes break down for absorption, fiber passes through the small intestine relatively intact. But don't let this fool you into thinking fiber isn't valuable. Its inability to be digested is precisely what makes it so beneficial for digestive health. There are actually several different types of fiber, each with unique properties and health benefits. Soluble fiber dissolves in water to form a gel-like substance in the digestive tract. This type of fiber, found in foods like oats, barley, legumes, apples, and citrus fruits, helps slow digestion, which can improve blood sugar control by preventing rapid spikes in glucose levels. Soluble fiber also binds to cholesterol particles in the digestive system, helping to remove them from the body before they can be absorbed into the bloodstream. This mechanism explains why foods rich in soluble fiber, like oatmeal, can help lower cholesterol levels. Insoluble fiber, on the other hand, doesn't dissolve in water, but passes through the digestive system largely unchanged. This type of fiber, found abundantly in whole grains, nuts, and vegetables, adds bulk to stool and helps food move more quickly through the stomach and intestines. It's particularly effective at preventing and relieving constipation, a common digestive complaint that affects people of all ages. By keeping things moving smoothly through the digestive tract, insoluble fiber helps reduce the risk of developing hemorrhoids and diverticular disease, a condition where small pouches form in the colon wall. Another way to categorize fiber is based on its fermentability, whether it can be broken down or fermented by bacteria in the large intestine. Highly fermentable fibers serve as prebiotics, essentially providing food for beneficial gut bacteria. When these bacteria ferment fiber, they produce short-chain fatty acids like butyrate, acetate, and propionate. These compounds provide numerous health benefits. They serve as the primary energy source for the cells lining the colon, help maintain the intestinal barrier, regulate inflammation, and may even influence appetite and metabolism through various signaling pathways. Foods particularly rich in these fermentable fibers include garlic, onions, leeks, asparagus, bananas, especially slightly underripe ones, oats, and legumes. The prebiotic effects of these foods help explain why a fiber-rich diet promotes a healthy gut microbiome, which, as we've discussed earlier, has widespread effects on overall health. The relationship between fiber and disease prevention is remarkably strong. Regular consumption of adequate fiber has been consistently linked to lower risk of numerous conditions, starting with digestive disorders. Diverticular disease, the formation of small pouches in the colon wall that can become painfully inflamed, affects about 50% of people over age 60 in Western countries. Multiple studies show that high-fiber diets, particularly those rich in insoluble fiber, significantly reduce the risk of developing this condition. Perhaps most impressive is fiber's connection to colorectal cancer prevention. Colorectal cancer is the third most common cancer worldwide, but research consistently shows that each 10 grams of fiber consumed daily reduces colorectal cancer risk by about 10%. This protective effect likely works through multiple mechanisms. Fiber speeds transit time through the colon, reducing exposure to potential carcinogens. Fermentation of fiber produces butyrate, which appears to inhibit cancer cell growth, and fiber helps eliminate bile acids and other compounds that could promote tumor development. Beyond digestive system benefits, fiber plays a crucial role in cardiovascular health. Soluble fiber's ability to lower LDL cholesterol has been extensively documented, with studies showing reductions of 5 to 10% when consuming adequate amounts. Fiber also helps regulate blood pressure and reduces inflammation, both important factors in heart disease prevention. Large population studies consistently show that people who consume the most fiber have significantly lower rates of heart disease and stroke compared to those who consume the least. Fiber also helps regulate blood sugar levels and may reduce the risk of developing type 2 diabetes. The gel-forming properties of soluble fiber slow the absorption of sugar, preventing rapid spikes in blood glucose after meals. Additionally, a high-fiber diet appears to improve insulin sensitivity, helping the body use insulin more effectively. For those already diagnosed with diabetes, increasing fiber intake can be an effective strategy for improving blood sugar control. Weight management represents another area where fiber proves valuable. High-fiber foods generally require more chewing, which slows eating and allows time for satiety signals to register. Fiber absorbs water and expands in the stomach, creating a feeling of fullness with fewer calories. The fermentation of fiber produces hormones that signal fullness to the brain. These combined effects may explain why higher fiber intake is associated with lower body weight and less weight gain over time in numerous studies. Given these wide-ranging benefits, health organizations worldwide recommend substantial daily fiber intake. The American Heart Association and American Dietetic Association suggest 25 grams daily for women and 38 grams daily for men. Other countries have similar or even higher recommendations, with some European guidelines suggesting 30 to 35 grams daily for all adults. Despite these recommendations, actual fiber consumption in most industrialized countries falls dramatically short. The average American adult consumes only about 15 to 17 grams of fiber daily, roughly half the recommended amount. This fiber gap represents one of the most significant nutritional shortfalls in the modern diet and likely contributes to the high prevalence of digestive disorders and other chronic diseases. What explains this widespread deficiency? The shift from whole, minimally processed foods to refined and ultra-processed products bears much of the responsibility. When grains are refined, the fibrous bran and germ portions are removed, dramatically reducing fiber content. For example, a cup of white rice contains less than 1 gram of fiber, while the same amount of brown rice provides about 3.5 grams. Similarly, fruit juices contain virtually no fiber compared to whole fruits, and many packaged snack foods and sweets contain minimal fiber despite being high in calories. Increasing fiber intake is straightforward in principle but requires some intentionality in our food-focused culture of convenience. Whole fruits, not juices, provide excellent fiber along with vitamins, minerals, and antioxidants. A medium apple with skin contains about 4.5 grams of fiber, while a medium pear provides about 5.5 grams. Berries rank among the highest fiber fruits, with a cup of raspberries delivering an impressive 8 grams. Vegetables, especially with edible skins or seeds, are fiber powerhouses. A cup of broccoli provides about 5 grams, while a medium avocado contains approximately 10 grams. Legumes, including beans, lentils, and peas, offer some of the highest fiber content of any food group. A cup of cooked black beans provides about 15 grams of fiber, nearly half the daily recommendation for men and more than half for women. Whole grains represent another excellent fiber source. Oats have received particular attention for their high content of beta-glucan, a soluble fiber with strong cholesterol-lowering properties. A cup of cooked oatmeal provides about 4 grams of fiber. Other fiber-rich grain options include barley, bulgur wheat, brown rice, and quinoa, technically a seed but used as a grain. Chia seeds and flax seeds deserve special mention for their extraordinary fiber content. 2 tablespoons of chia seeds contain about 10 grams of fiber. For those struggling to consume enough fiber through food alone, fiber supplements can help bridge the gap. Options include psyllium husk, methylcellulose, wheat dextrin, and partially hydrolyzed guar gum. While supplements can be valuable, most nutrition experts recommend focusing primarily on fiber from whole foods, which provide additional nutrients and beneficial plant compounds not found in isolated fiber supplements. An important practical consideration when increasing fiber intake is to do so gradually. A sudden dramatic increase can cause uncomfortable gas, bloating, and altered bowel habits as the digestive system adjusts. Adding just a few grams of fiber daily each week while ensuring adequate hydration allows the gut microbiome and digestive processes to adapt. Most temporary discomfort resolves within a few weeks as the body adjusts to higher fiber intake. Hydration deserves special emphasis when discussing fiber. Many of fiber's benefits, particularly those related to preventing constipation, depend on adequate fluid intake. Soluble fiber absorbs water like a sponge, forming that beneficial gel-like substance in the digestive tract. Without sufficient water, high fiber intake can actually worsen constipation rather than relieve it. A good rule of thumb is to drink at least 8 8-ounce glasses of fluid daily when consuming a high-fiber diet, with additional fluid needed during hot weather or exercise. Looking toward the future, fiber research continues to evolve in fascinating directions. Scientists are investigating how specific types of fiber affect different bacterial populations in the gut, potentially allowing for more targeted dietary recommendations based on an individual's unique microbiome composition. Research into the mechanisms behind fiber's cancer protective effects may lead to more specific guidance about which fiber types offer the strongest protection. The interaction between fiber and other dietary components also represents an emerging research area. For instance, certain polyphenols, plant compounds found in colorful fruits, vegetables, tea, and cocoa, appear to enhance fiber's beneficial effects on the gut microbiome. Similarly, the combination of fiber with healthy fats like those in olive oil may offer synergistic benefits greater than either component alone. The growing understanding of fiber's fundamental importance for health represents a powerful reminder that sometimes the simplest, most basic aspects of nutrition provide the greatest benefits. In our culture's pursuit of the latest superfoods or supplement trends, the humble recommendation to eat more fiber may not seem exciting or novel. Yet, the consistent research linking adequate fiber intake to reduced risk of numerous chronic diseases, from digestive disorders to heart disease, diabetes, and certain cancers, underscores that few nutritional changes offer more widespread health benefits than simply increasing the amount of fiber-rich, minimally processed plant foods in our daily diet. While fiber intake remains important throughout our lives, the way our digestive system functions undergoes significant changes as we age. Have you noticed that older family members seem to have more digestive complaints than they did when they were younger? This isn't coincidental. Age-related changes to the digestive system represent a normal part of growing older, though their impact varies considerably from person to person. Understanding these changes can help us take proactive steps to maintain digestive health as we age. From our 30s onward, our digestive system begins a gradual transformation that continues throughout life. One of the earliest changes involves decreased production of stomach acid, a condition called hypochlorhydria. By age 60, about 20 to 30% of people produce significantly less stomach acid than in their youth. This reduction might seem beneficial for those concerned about acid reflux, but stomach acid serves crucial functions. It activates digestive enzymes, helps break down proteins, and creates a hostile environment for harmful bacteria. With less acid, protein digestion becomes less efficient, and the risk of certain bacterial infections may increase. The production of digestive enzymes also typically declines with age, particularly pancreatic enzymes. This reduction can affect how efficiently we break down proteins, fats, and carbohydrates. Some older adults may notice they have more difficulty digesting fatty meals or high-protein foods than they once did. Combined with reduced stomach acid, these enzyme changes help explain why nutritional deficiencies become more common in older populations despite adequate food intake. Motility. The coordinated muscle contractions that move food through the digestive tract generally slows with age. In the stomach, delayed emptying can contribute to feelings of fullness, bloating, or nausea after eating. In the intestines, slower transit time increases the risk of constipation, one of the most common digestive complaints among older adults. By some estimates, 30 to 40% of adults over age 65 experience chronic constipation. The composition of the gut microbiome shifts with age as well. Studies comparing the microbiomes of younger adults with those of older individuals typically find reduced diversity in older populations, with decreases in beneficial species like bifidobacteria and increases in potentially inflammatory bacteria. These changes may contribute to the low-grade chronic inflammation often observed in older adults, sometimes called inflammaging, which has been linked to various age-related conditions, including cognitive decline, cardiovascular disease, and frailty. Structural changes occur throughout the digestive tract with aging. The muscles controlling swallowing often become weaker, potentially leading to difficulties swallowing, dysphagia, or increased risk of food or liquids entering the airway. The internal layer of the intestines tends to thin, and the blood vessels supplying the digestive organs may develop atherosclerosis, potentially reducing blood flow and nutrient delivery. The liver typically shrinks in size and processes certain medications and toxins more slowly. The nerve networks controlling digestive function, known as the enteric nervous system, also experience age-related changes. Some neurons are lost over time, and those that remain may function less efficiently. These neural changes can affect everything from the sensation of hunger and fullness to the coordination of muscle contractions throughout the digestive tract. Beyond these normal age-related changes, older adults face additional challenges that can impact digestive health. Medication use increases dramatically with age, with the average person over 65 taking 5 or more prescription medications. Many commonly prescribed drugs can affect digestion through various mechanisms. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, can irritate the stomach lining and increase the risk of ulcers. Many blood pressure medications and antidepressants list constipation as a side effect. Some Parkinson's disease medications and calcium channel blockers can slow stomach emptying. Antibiotics, while sometimes necessary, can disrupt the gut microbiome, potentially leading to diarrhea or other digestive symptoms. This phenomenon of multiple medication use, known as polypharmacy, creates complex interactions that can significantly impact digestive function. When digestive symptoms emerge in older adults, determining whether they stem from normal aging, an underlying condition, medication side effects, or some combination of these factors becomes an important clinical challenge. Chronic health conditions that become more common with age can further affect digestive health. Diabetes often causes gastroparesis, a condition where the stomach empties too slowly. Neurological conditions like Parkinson's disease and stroke can affect the coordination of muscles involved in swallowing and digestion. Hypothyroidism, more prevalent in older adults, commonly causes constipation. Even conditions not directly related to the digestive system, like heart failure or chronic kidney disease, can impact digestive comfort and function through complex systemic effects. Despite these challenges, digestive health in aging isn't simply a story of inevitable decline. Various strategies can help maintain digestive function and comfort throughout the later years of life. Nutritional approaches play a central role in supporting digestive health in older adults, though the specific recommendations sometimes differ from those for younger individuals. Protein needs actually increase with age, contrary to the common assumption that older adults need less protein because they're often less physically active. Research suggests that older adults require more protein per pound of body weight than younger adults to maintain muscle mass and support immune function. However, the decreased digestive enzyme production mentioned earlier can make high-protein meals challenging for some. Spreading protein intake throughout the day in moderate portions rather than consuming it primarily at one meal can improve digestion and absorption. Including some protein at breakfast, a meal that's often carbohydrate-heavy or skipped entirely by many older adults, appears particularly beneficial for maintaining muscle mass. Adequate hydration becomes increasingly important with age, yet often more challenging. The sensation of thirst diminishes in older adults, and some intentionally limit fluids, due to concerns about nighttime urination or incontinence. This reduced fluid intake commonly contributes to constipation. Setting regular reminders to drink water throughout the day can help maintain proper hydration. For those concerned about nighttime bathroom trips, focusing fluid intake in the morning and early afternoon represents a reasonable compromise. Fiber remains crucial for digestive health in aging, though the approach sometimes requires adjustment. While adequate fiber helps prevent constipation, suddenly increasing fiber intake without sufficient hydration can actually worsen symptoms. A gradual increase paired with plenty of fluids works best. For some older adults with slow transit time or certain digestive conditions, soluble fiber, found in oats, barley, and fruits, may be better tolerated than insoluble fiber, found in wheat bran and many vegetables. Several nutrients deserve special attention in older populations due to their impact on digestive health. Vitamin D deficiency becomes more common with age due to reduced sun exposure, decreased skin synthesis, and often lower dietary intake. Beyond its well-known role in bone health, vitamin D appears to influence gut inflammation and microbiome composition. Adequate B vitamins, particularly B12, support proper nerve function throughout the digestive tract, yet absorption typically decreases with age. Magnesium, involved in muscle function and bowel regularity, is often deficient in older adults due to decreased absorption, increased excretion, and medication interactions. The timing and structure of meals can significantly impact digestive comfort for older adults. Many find that smaller, more frequent meals cause less discomfort than 3 large meals daily. Having the largest meal earlier in the day when digestive function is typically more efficient rather than in the evening can reduce nighttime symptoms like reflux or indigestion. Thorough chewing becomes particularly important with age, compensating somewhat for reduced enzyme levels and potentially decreasing swallowing difficulties. Physical activity maintains a special relationship with digestive health throughout life but takes on even greater importance with age. Regular movement stimulates the muscle contractions that move food through the digestive tract, helping prevent constipation. Exercise also supports the diversity and health of the gut microbiome, potentially counteracting some age-related changes. The type of activity doesn't need to be strenuous. Walking, swimming, gentle yoga, or tai chi all offer benefits. Even bed-bound individuals can benefit from range of motion exercises and gentle abdominal massage to stimulate digestive function. Mind-body practices offer another avenue for supporting digestive health in aging. Chronic stress can exacerbate many digestive symptoms, and older adults often face significant stressors including health concerns, financial pressures, loss of loved ones, and major life transitions. Practices like meditation, deep breathing, and progressive muscle relaxation can activate the rest and digest parasympathetic nervous system, potentially improving digestive function. Some evidence suggests these practices may be particularly beneficial for functional digestive disorders that become more common with age, like IBS and functional dyspepsia. For those experiencing more significant digestive challenges, various supportive products can help maintain quality of life and independence. Adaptive eating utensils assist those with arthritis or neurological conditions that affect dexterity. Specially designed cups reduce the risk of aspiration for those with swallowing difficulties. Modified food textures, from soft to pureed, allow continued enjoyment of meals despite chewing or swallowing challenges. These practical solutions often make the difference between maintained independence and requiring assistance with meals. When addressing digestive health in older populations, medication management represents a crucial consideration. Regular medication reviews with healthcare providers can identify drugs that might be causing or contributing to digestive symptoms. Sometimes alternative medications with similar therapeutic effects but fewer digestive side effects are available. In other cases, additional treatments to counteract medication side effects might be appropriate. For example, someone who requires NSAIDs for arthritis pain might also take a medication to protect the stomach lining. The approach to digestive health in aging should always consider overall quality of life rather than focusing narrowly on eliminating symptoms at any cost. For instance, while fiber supplements might effectively treat constipation, they could potentially worsen bloating or gas in some individuals. If these secondary symptoms significantly affect comfort or social activities, a different approach might better serve overall well-being. Similarly, while eliminating certain foods might reduce specific digestive symptoms, overly restrictive diets can lead to malnutrition, reduced enjoyment of meals, and limited social engagement, all factors that significantly impact quality of life in older adults. This balanced perspective becomes particularly important when addressing digestive health in the context of multiple health conditions, which is common in older adults. Treatments that might be standard for one condition sometimes need modification when considering their impact on digestive comfort and function. The most appropriate approach often involves compromise and personalization rather than strictly following generic treatment protocols. Communication about digestive symptoms sometimes presents challenges for older adults who may have grown up in generations where discussing bodily functions was considered impolite or embarrassing. Some may assume that digestive discomfort is simply an inevitable part of aging that must be endured rather than a potentially treatable condition. Healthcare providers can help by asking specific questions about digestive function during routine visits and normalizing these discussions. As our understanding of age-related changes to the digestive system continues to evolve, so do the strategies for maintaining digestive health throughout the lifespan. Rather than viewing digestive challenges as inevitable consequences of aging, we're increasingly recognizing opportunities to support digestive function through targeted nutritional approaches, appropriate physical activity, stress management, and judicious use of medications and supplements when needed. This proactive approach helps ensure that digestive health remains a source of well-being rather than distress throughout the later years of life. This proactive approach to digestive health at any age opens the door to exploring the remarkable innovations happening in how we treat digestive disorders. For those who've struggled with functional gastrointestinal disorders, conditions like IBS, functional dyspepsia, or chronic constipation that cause significant symptoms without visible damage or inflammation, the past decade has brought exciting developments in treatment options. These emerging therapies go beyond the traditional take this medication approach to address the complex, multifaceted nature of these challenging conditions. Have you ever wondered why conventional treatments for digestive disorders don't work for everyone? Functional gastrointestinal disorders, FGIDs, affect between 15 and 25% of the population worldwide. Yet they've historically been difficult to treat effectively. These conditions have often been viewed as less legitimate than disorders with visible inflammation or structural abnormalities, despite causing significant suffering and reduced quality of life. Fortunately, our understanding of these conditions has evolved dramatically, leading to innovative treatment approaches that address the underlying mechanisms rather than just managing symptoms. One of the most fascinating developments has been the growing evidence for gut-directed hypnotherapy. When many people hear hypnotherapy, they might think of stage performances or quitting smoking, but clinical hypnotherapy is quite different. Gut-directed hypnotherapy uses deeply relaxed states to deliver specific therapeutic suggestions focused on normalizing gut function and reducing pain perception. The results from multiple randomized controlled trials have been remarkably impressive. Between 70 and 80% of IBS patients experience significant improvement, with benefits often lasting years after the treatment ends. During gut-directed hypnotherapy sessions, patients enter a state of focused attention and heightened suggestibility while a trained therapist guides them through visualization exercises specifically designed for digestive disorders. They might visualize their digestive tract functioning smoothly and comfortably, or imagine a control room where they can adjust dials to regulate gut sensitivity and motility. Some protocols include visualization of healing warmth spreading through the abdomen, or imagining the nervous system becoming calmer and more balanced. What makes gut-directed hypnotherapy particularly appealing is its excellent safety profile. Side effects are minimal and generally limited to occasional mild sleepiness after sessions. Unlike many medications, hypnotherapy doesn't require ongoing treatment to maintain benefits. Most protocols involve 12 sessions over 3 months, with improvements often persisting for years. While not everyone responds to this approach, those who do typically experience substantial relief from symptoms that may have been resistant to other treatments. Targeted probiotic therapy represents another advancing frontier in FGID treatment. Rather than the one-size-fits-all approach of early probiotics, researchers are identifying specific bacterial strains that address particular symptoms or underlying mechanisms. For example, certain strains of Bifidobacterium infantis have shown promise specifically for abdominal pain and bloating in IBS, while Lactobacillus plantarum appears more effective for gas and irregular bowel movements. The future of probiotic therapy lies in precision matching of specific strains to individual patients based on their symptoms, microbiome composition, and potentially even genetic factors. Combination products containing multiple carefully selected strains are showing better results than single-strain formulations in many studies. Some newer approaches include synbiotics, combinations of probiotics with prebiotics that specifically feed those beneficial bacteria, potentially offering longer-lasting benefits by helping the introduced bacteria establish themselves more effectively in the gut ecosystem. Pharmacological approaches to FGIDS are becoming more sophisticated as well, with new classes of medications targeting specific underlying mechanisms rather than just addressing general symptoms. Neuromodulators, which affect how pain signals are processed and transmitted, have shown particular promise. While older tricyclic antidepressants have been used for decades in low doses for functional gut disorders, newer classes of antidepressants with different mechanisms and side effect profiles offer additional options. A novel class of drugs called peripheral-acting mu-opioid receptor antagonists works by blocking opioid receptors specifically in the digestive tract without affecting the central nervous system. This targeted approach helps address the constipation and digestive slowing that often occurs with opioid pain medications while avoiding the withdrawal or reduced pain control that would result from blocking opioid receptors throughout the body. Beyond their use in opioid-induced constipation, these medications show promise for certain forms of IBS and functional constipation. Drugs targeting specific serotonin receptors have revolutionized treatment for some patients with severe IBS. Serotonin, often associated with mood regulation in the brain, actually exists in much higher concentrations in the gut, where it helps regulate pain sensitivity, secretion, and motility. Medications that activate or block specific serotonin receptors in the gut can help normalize bowel function in both diarrhea-predominant and constipation-predominant IBS, though their use requires careful patient selection due to potential side effects. Mind-body interventions beyond hypnotherapy are gaining scientific validation for FGID management. Mindfulness-based stress reduction, MBSR, has shown effectiveness comparable to many conventional IBS treatments in controlled studies. This approach involves learning to pay attention to present-moment experiences without judgment, developing awareness of the connections between thoughts, emotions, and physical sensations, and cultivating a compassionate attitude toward one's experiences. Cognitive behavioral therapy, CBT, adapted specifically for digestive disorders, helps patients identify and change unhelpful thought patterns and behaviors that may be maintaining or worsening symptoms. For example, catastrophizing about symptoms, "This pain will never end," or "I won't be able to leave the house because of my symptoms," can increase stress and actually worsen physical discomfort through the gut-brain connection. CBT helps replace these thoughts with more balanced perspectives while also addressing behaviors like avoidance of activities or excessive focus on symptoms. Interestingly, digital delivery of these mind-body interventions through smartphone apps or online programs has shown effectiveness comparable to in-person therapy for many patients. This digital approach dramatically increases accessibility, allowing patients to receive evidence-based psychological treatment regardless of geographic location or therapist availability in their area. Perhaps the most dramatic emerging therapy for digestive disorders is fecal microbiota transplantation, FMT, which involves transferring stool from a healthy donor to a recipient to restore a healthy microbial community. While this approach sounds unusual, it's based on the understanding that the microbiome plays a crucial role in digestive function and overall health. FMT has shown remarkable success rates, over 90% in most studies, for recurrent Clostridium difficile infection, a potentially life-threatening condition that can develop after antibiotic use disrupts the normal gut microbiome. Based on this success, researchers are exploring FMT's potential for other digestive disorders, with promising preliminary results for conditions including ulcerative colitis, IBS, and even non-digestive conditions like autism that may have a gut microbiome component. The administration methods for FMT have evolved significantly, moving beyond colonoscopic delivery to include less invasive options like encapsulated preparations, essentially poop pills, that can be taken orally. These capsules are specially coated to pass through the stomach and release their contents in the intestines. This development has made the treatment more accessible and acceptable to patients while maintaining effectiveness. While FMT shows tremendous promise, researchers are working to identify exactly which components of the donor stool provide the therapeutic benefit. This could eventually lead to synthetic preparations containing specific beneficial bacteria without the need for actual stool donation, potentially improving standardization and safety. All these emerging therapies point toward a broader shift in FGID treatment, the move toward personalized medicine approaches. Rather than treating all patients with the same diagnosis identically, clinicians are increasingly using biomarkers, genetic testing, microbiome analysis, and detailed symptom assessment to tailor treatment to individual patients. For example, certain genetic variations affect how quickly the body metabolizes medications, influencing both effectiveness and side effect risk. Testing for these variations can help determine optimal dosing or whether a particular medication is likely to work for a specific patient. Similarly, analysis of the gut microbiome composition might indicate whether a patient is likely to respond to specific probiotics or dietary interventions. Symptom clusters also help guide personalized treatment selection. Someone with IBS whose primary symptom is abdominal pain might benefit most from neuromodulators or hypnotherapy, while someone whose main concern is irregular bowel movements might do better with fiber supplements or medications targeting gut motility. This personalized approach represents a significant improvement over the traditional trial-and-error method that has frustrated many FGID patients, who often cycle through multiple treatments before finding something helpful, if they find relief at all. By targeting treatments to the specific underlying mechanisms at play in each individual, the personalized medicine approach offers the potential for faster symptom improvement with fewer side effects. For patients navigating these emerging options, working with healthcare providers who stay current with advances in FGID treatment is crucial. Gastroenterologists specializing in functional disorders, integrative medicine physicians, and specialized dietitians can often provide access to cutting-edge approaches that may not yet be widely available in general practice. Patient advocacy also plays an important role in advancing treatment options. Organizations like the International Foundation for Gastrointestinal Disorders, IFFGD, and the Rome Foundation work to promote research, education, and awareness about functional digestive disorders. Their efforts have helped reduce stigma around these conditions and increase research funding for new treatment approaches. As our understanding of the complex interplay between the microbiome, nervous system, immune function, and psychological factors in FGIDS continues to evolve, we can expect treatment options to become increasingly sophisticated and effective. The days of being told it's all in your head or learn to live with it are giving way to a more nuanced understanding of these real physiological conditions and the multiple pathways through which they can be effectively addressed. For the millions of people worldwide affected by functional digestive disorders, this shifting landscape offers renewed hope. The emerging treatments we've discussed, from gut-directed hypnotherapy to targeted probiotics, innovative medications, mind-body interventions, fecal microbiota transplantation, and personalized medicine approaches, provide more options than ever before for finding relief from symptoms that can significantly impact quality of life. While there's still much to learn about these complex conditions, the rapid pace of discovery and the increasingly sophisticated treatment options suggest that better days lie ahead for those struggling with these challenging digestive disorders.